Welcome to Day and Night News Prime Debate. The Centre has passed a new law to regulate clinical establishments throughout the country. This law prescribes minimum standards for healthcare providers and registers them. The IMA, however, is against the move. Tonight on Prime Debate, we try to find out whether such a bill is required, and if not, then why so? Concerns about how to improve healthcare quality have been raised frequently by the general public and other stakeholders. Addressing these concerns, the Centre has come up with the Clinical Establishment Registration and Regulation Bill 2010. The bill, if implemented, is likely to make life difficult for private practitioners. The private sector healthcare delivery system in India has remained largely unregulated and uncontrolled. Criticism points to inadequate and inappropriate treatment, excessive use of higher technologies, wasting of scarce resources, medical malpractice and negligence. To deal with this, the Centre has brought about a legislation which will require private players to not only maintain clinical records and supply these to patients, but also make and enforce a schedule of charges for all kinds of treatment. The Clinical Establishment Act 2010 applies to every type of clinical establishment, including single doctor establishments with or without beds. The Act aims to create a regulatory act which, while protecting the interests of patients, will put an end to unscrupulous activities by medical establishments. But health is a state subject and the states may or may not adopt this bill. Some states like Himachal Pradesh, Arunachal Pradesh, Sikkim, Mizoram and all union territories have already adopted the bill, but Punjab government has decided not to embrace the bill. A resolution against this bill has been passed unanimously by the Punjab Legislative Assembly. This has come as a respite for the doctors' organizations in Punjab who have been opposing the bill. They are of the view that by implementing this bill, the doctors will be compelled for huge investment on hospitals, which would increase healthcare costs to the patients. The doctors have defined it as anti-people and a move to curtail freedom of medical practice. To discuss this issue, we have in our studios Dr. Zora Singh, who is the President of Indian Medical Association, Chandigarh, Gurteej Singh, CEO of IV Hospital. We also have with us the State Organizing Secretary of Indian Medical Association, Punjab, Dr. Amandeep Agarwal. Welcome to our studios, everybody. Before we move ahead with the discussion, let's hear what Health and Planning Secretary of Punjab, Satish Chandra, had to say when asked that why the Punjab government is contemplating legislation for regulating private hospitals, clinics, etc.
Actually, Punjab government is not exactly contemplating. There is a reference from Government of India. Most of the states, like about 15, 16 states in India, they have their own regulatory act. Then Government of India has also recently enacted an act. So Government of India says either Punjab should enact its own act or they should adopt Government of India act. So we referred the matter to Cabinet. Cabinet has appointed a subcommittee comprising of 4 ministers, Health Minister, Finance Minister, Medical Education Minister and Food and Supplies Minister. They would submit their report and then Cabinet would take a final decision. So it's basically on account of reference of Government of India that we are considering enacting this act.
Dr. Zora Singh, let me begin with you. We all heard Mr. Satish Chandra, who said that it's on the reference of Government of India that we are considering enacting this act. Do you feel that the state government is changing its stand on this issue?
You see, it's just the old wine in new bottles only. The Clinical Establishment Act, it has been opposed tooth and nail by IMA. Our stand is very clear. It's anti-people. It will exaggerate the cost of treatment to the patients.
How it's anti-people?
Because in Clinical Establishment Act, there are certain statutory requirements as one has to qualify for to run a medical establishment.
Right.
As a doctor, I am a registered doctor already. So if I am to run a clinic or hospital, I will have to get it registered again.
Okay.
So that will promote just the inspector Raj. That will just promote the license Raj. So that, of course, how we can get the license and how we can get the inspections conducted in India. We all know it's very obvious how costly these affairs are, and this cost is going to fall on the patients.
Okay.
So this bill, of course, it's anti-public, and it's against the profession as well.
Right.
Yeah.
So, Gurtej Singh, who would you agree with?
Jasleen, it would be very important for us to first divide the question into three verticals. Why to regulate, what to regulate, and how to regulate. I would not agree with Dr. Zohra Singh terming this bill or this proposal as anti-public, because healthcare is not a domain of just the clinician who's practicing from his house or his nursing home. He has a social responsibility. The responsibility extends not just to one patient, not just to one community, not just to the region, but it transcends the barriers of the nation, reaching out to the global patients who are now looking at Indian medical establishments for treatments.
Right.
It is a huge opportunity, and unless we are able to stipulate minimum parameters, there will be exploitation of the patients who come here unscrupulously, believing that Indian healthcare is offering them quality services at affordable prices. Dr. Zohra Singh is right to an extent that he is a registered medical practitioner, but whether he has been able to equip the clinical establishment to the standards which are needed to provide the essential medical care, in some cases super specialty and specialty healthcare, that has to be ascertained. This was why I very emphatically say that it needs to be regulated.
It needs to be regulated.
Yeah, but of course his concerns are not invalid as to the exploitation of the clinicians at the hands of the inspectors or the approval agencies. The government has more than that as a responsibility.
Right.
If they are trying to make the clinicians invest in the infrastructure and bring more trained, qualified, experienced professionals to work in their clinics to dispense with the medical treatment, then they have to insulate those doctors and those establishments against exploitation from these agencies.
Right. To some extent, he is not agreeing with you. Yeah.
I would like to add some point into it.
Yeah.
You see, the regulation by the government and the regulation as a good institute, how I can raise the standards of, they are two different things. Today is the era of autonomy and competitiveness. My institution, my hospital, I would go for JCI, I will go for NABH, I will go for Quality Council of India certification instead of going for the certification from the Deputy Commissioner.
Right.
So like the issue of medical tourism is coming. So you see, medical tourism, and our national health policy says that the foreign patients, it should be considered as an export. So it's a big asset. But when we are regulated by the government setup, it is detrimental to the profession. But the quality control, self-quality control, like a JCI accreditation, NABH or Quality Council of India or competitiveness otherwise, there are so many institutes in Chandigarh,
Right.
Like Forty Hospital, IV Hospital and some other, they are qualified. They have met out the standards. These standards have not forced upon them. It was not compulsory for them. But by virtue of they wanted to raise themselves, they adopted these standards,
Right.
and they are the best institutions now.
Dr. Agarwal, what would you like to say on this? That if government will interfere, then it will prove detrimental.
Definitely, it shall prove to be a death bell for the private clinicians. Most of the 90% of the private practice is owned by one person show or a couple doctor owning the clinic or nursing home. And the corporate or the big hospitals which are putting pressure on the government to implement this act, they will succeed. And only they will be the gainers, plus the government officials who will be taking their monthlies or they will be using it as a tool of blackmail. They will be gaining.
Right.
Who will be the loser? The doctors, they will be the losers. The Aam Aadmi, about which the government speaks so loud, they will be the loser.
So, but they are saying that it's in the benefit of the Aam Aadmi.
That is only they are saying. While as they are doing it under the pressure of the big corporate houses,
Okay.
The small setups, if they have to meet all the standards, they will just be crushed under the weight of the investment they make.
All right. See, we also asked Mr. Satish Chandra that is it important to regulate the private hospitals and why? This is what he has to say.
It is important for two issues. Firstly, like Government of India, state government have number of schemes, and we have to approach them for various works like Jani Surakshya Yojana, Surakshit Janepa Yojana, and like our cooperative department also impanels various hospitals for its Bhai Kanhaiya insurance scheme. So for every program we have to invite applications for private hospitals, evaluate them and then accredit them. So if there is a mechanism under which all these private hospitals are accredited, then it will be easier for all the departments. Secondly, for public also it is very important. They should know which hospital has what kind of facility, which hospital should have what kind of facility, whether it meets all the requirement or not. So these days, the public really doesn't know what is happening. Thirdly, these hospitals are performing very important work, and they are required to have doctors and qualified paramedics staff. And the world really doesn't know whether they have qualified staff or not, whether they meet the norm or not. So under the contemplated act, like regulatory act, there's only one basic criteria that all the hospitals should have some minimum basic standards in terms of civil works, equipment and medicine and manpower.
Now, Dr. Agarwal, I'll ask you that Mr. Satish Chandra, he spoke about all the yojnas and he also said that it will help public in a way, and he also said that the world really doesn't know whether they have a qualified staff or not. I'm talking about the private hospitals, and whether they meet the norms or not. Would you agree with him?
No, Jocelyn, I have a strong disagreement. Already 45 acts they are regulating the doctors. Doctors are regulated by the medical councils. Doctors are under the Consumer Protection Act. They are regulated by the courts. And when he is talking about whether we are meeting with the standards or not, let me tell you that 50% of the indoor patients are treated in the private hospitals, and 75% they are of the outdoor patients, they are treated in the private setups. And he was also speaking about Bhai Kanhaiya scheme.
Hanji.
In Bhai Kanhaiya scheme, there is one funny provision, just an example I am telling you, that for hernia repair, say it takes place at Sangrur, the patient will be paid, the doctor will be paid 7,500, and if same repair takes place at Ludhiana in a big hospital, the doctor will be paid 35,000.
Why this disparity?
They have graded the cities, and according to the city level, the doctors are paid.
Okay.
While as the investment is the same. So this is a sort of discouraging the doctors from setting up their centers in small cities.
Right, we'll come to you. Dr. Zohar Singh, before we went into the break, Dr. Agarwal was actually has given us some figures about the disparity between any treatment which will take place in a city like Sangrur and another treatment which will take place in the city like Ludhiana. Why so?
Just I would like to highlight one more very, very important point in Clinical Establishment Act. That is the stabilization of the patient. Under the Act, any